Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Randall back with us today, and I'm sure you remember Randall from about a year ago. He brought his little dog baby in here, who we adjusted, and that's on our YouTube channel. And we adjusted her sacroiliac joint in her low back area because she was dragging her legs and having incontinence, which is abnormal, unconscious wetting of herself, and bladder and bowel dysfunction. Basically, it's neurological dysfunction. And I just talked to Randall about her, and he says she's been doing great ever since. And they've been feeding her this new food with omega-3 fatty acids, and she's even doing better.
Yep.
So,
Absolutely.
So you got one adjustment.
Yep, one adjustment.
One time, yep. And Randall's back in here today for a maintenance care evaluation, which is just supportive care. We saw him regularly at first for automobile accident injuries that he had to his cervical, thoracic, and lumbar spine regions. And we saw him initially 3 times a week and then 2 times a week, and dropped him down to once a week for a little while. And then we released him in May of this year. And this is the first time you've been back in since May, huh?
Yes.
Yeah.
Yes.
So we're going to check him for the first time since May now and see what he's got going on, because he's got some neck and upper back stuff that's been coming back, as well as some mid back and lower back. So let's relax your hands for a second and flex your head forward and then backwards. So this is how a person should treat themselves with chiropractic care after they're released from an active care program. They should just look in the mirror, which I'm sure you've been doing at your posture. And you can see how your neck's a little bit over to the right of center. And evaluate their posture and feel their body so that they know when to come in for a tune-up, basically, is what we call these maintenance adjustments or supportive care. Very good. Okay. So
here.
we're going to go ahead and decompress you first.
All right. Sounds good.
Yep. Okay. So you guys should probably, you crack addicts out there on our channel are going to get a lot of good noise fixes on this one, because I'm sure he'll be moving really good. Okay, slide down just a little. There we go. Perfect. Good. Okay. You been staying busy?
Yeah.
Yeah.
Yeah. Definitely. It's not squeaking as much anymore.
No. No. We put some WD-40 on it, so it's not making the squeaking noises so bad now. There we go. Okay. Now remember, just keep your teeth together and take a deep breath through your nose. And let it all out and relax. Just like that.
Yeah.
You feel that all the way down?
Yes, sir.
Good deal.
Needed that.
Yeah, I did that kind of gentle for you today. I wanted to do it smooth, but see, he's still kicking even better.
Even better.
This is my Palmer diversified cervical adjustment, and I know y'all don't like me to talk while I'm doing it, so I try to
Those were good.
Oh, yeah.
adjust in between sentences. It's hard for me not to talk and work at the same time,
Yeah.
because I like to explain everything that I do.
Well, you're a teacher, so by trade.
Yeah, I am a teacher. Okay, let's go.
He was voted most talkative in high school.
Yeah, I was voted most talkative in class clown in high school, so it comes naturally to me. And there's probably a bunch of you chiropractors around the country that remember Select Success seminars back in the early 90s, from about 1990 to 96, with Dr. Dan Murphy, the spinal trauma, whiplash spinal trauma, and soft tissue injury seminars. That's a company that I started. Dan Murphy and myself held seminars around the country in 3 cities a month for like 6 years, and people who completed our courses got a chiropractic certification in spinal trauma, diagnosis, treatment, and rehabilitation, called CCST. There we go. Good. I'm going to put your head down just a little bit to open these joints up. Oh, yes. Excellent. Perfect. That's it, my friend. We got one more right here. I can feel it. Yep. Good job.
All right. My left foot, like the
Bottom?
Arch.
Oh,
It's
down in
been
here?
killing me lately.
Right in
Yeah.
here?
Yeah.
Yep. You might have a little bit of beginning plantar fasciitis right there.
Yeah.
Is that where it's hurt mostly?
Yes,
Right
sir.
there?
Right there.
Yeah. So we just put some deep static pressure. Actually, we got a brand new tool for that kind of thing too. It's a rapid release technologies. It's a hypersonic vibration that gets way down in there. Right, we're going to feel some really deep frequency vibration down in there, and it'll probably be a little bit warm too.
It feels good though.
Yeah, it'll feel good. This will break up scar tissue and adhesions and myofascial pain syndrome. It's got multiple heads on it that you can use to get different depths and frequencies on. Folks, this is really good for like tendonitis, plantar fasciitis. Excellent for carpal tunnel syndrome. There we go. And then the broad, here's some more. Very good. Let's get this one just for good measure.
Oh yeah.
That tickles a little bit.
Yeah, it's like reflexes.
And this is a lot higher frequency. In fact, that's the science behind this, is it's a high frequency wave that gets down deeper into the fibrotic adhesions that are in there, in the myofascial tissue, which is the covering of the muscles. And it breaks up the abnormal fibrotic scar tissue and adhesions that develop from cumulative trauma or post-trauma, like whiplashes and soft tissue injuries. Your legs are exactly even now, and I bet you that doesn't hurt at all in your low back.
No, not
Excellent.
at all.
Very good. Okay, let's turn you on your back now.
All right.
Good man. Alright, there we go. Excellent. Did you feel that in your knee and your back?
Yes, sir.
Okay. Yeah, same here. Ooh, this one's a little bit loose today. There we go.
Yeah.
We got another one. There it is, better.
All right.
Okay. Yeah, let's sit you up sideways and face towards your knee. There we go. Good. You know what? He's been having some pain out into his shoulder blade too, so I'm going to use that rapid release on that too to break those trigger points up. That shoulder's actually
This one, yeah, this elbow. It's
this elbow.
Yeah, I kind of injured this tendon like all through here,
Okay.
and it likes to flare up.
Like
on
playing
me.
racquetball or?
Just working out.
Oh,
Just
okay.
lifting weights, I think, is how I did it.
Okay. Yeah, we got no saying in here. You knock them out, I line them up.
Yeah.
Okay, let's go ahead and lay back on your tummy though for just a couple more minutes. I want to put this on your shoulder blade trigger points. So I'm going to pull your shirt down here just a little bit. Is it this left one more or the right one more?
Right one.
Okay. Out in your trap here and down into your rhomboid right in here. We're going to use this point here to get a little bit more on the trigger point. Ooh, right in there, huh?
Yeah. Oh yeah.
You see, you don't have to really put any pressure on this because it's so deep of a vibration and frequency. It gets way down in there anyway. Just follow that right around the scapula there and get the rhomboids as well. Probably some tender spots in there along the way, huh?
Oh yeah. But it,
Feels good though, huh?
yeah. Yeah.
Yeah, I'm really liking this so far. We've only been using this for 2 days in the office.
Oh wow.
Oh, by the way, for all of you chiropractic students who may be watching us from Palmer or Life West, we are going to be hiring a new chiropractor who is full of integrity and character and passion and purpose, and who is a really good hands-on adjuster, preferably knowing Palmer package and chiropractic BioPhysics. because we're expanding our practice right here in this location to a whole nother suite. And bringing on massage therapists and natural weight loss programs. And then also we're going to be expanding up into the Woodlands in 2016.
Oh wow, that's awesome.
Yep. So we're going to need another chiropractor to do exactly the same thing that I'm doing. So if you fit that bill and are interested in Advanced Chiropractic Relief, send your CV to yourhoustonchiropractor@gmail.com. Very good. And that's my direct email address for business and personal. And every time you guys make a comment, that gets sent to that email address. So I'm just going to give it to you. It's yourhoustonchiropractor@gmail.com. And send me a full CV with at least 3 personal and professional references. And of course, what college you've been to, what seminars you've taken, what techniques you utilize, and if you've got any videos that you want to point me towards on YouTube, or just videos you want to send out in an email, feel free to send those as well so I can take a look at your adjusting techniques. That's not mandatory. I'm going to be taking applications and screening people over the course of the next couple of months. Renee and I are leaving on vacation on December 21st through the 5th of January. We're going to St. Thomas, U.S. Virgin Islands for Christmas and her birthday on the 1st. So we won't be here at that point in time. So we won't be doing any videos from Houston. We'll be doing some from St. Thomas. I'll show you some underwater adjustments, scuba diving. That'd be kind of fun.
So Renee drowning?
Yeah, I could drown Renee on there. No, I don't want to do that. She's too valuable. Plus, I'd miss her. She's an integral part of this practice, isn't she, Randall?
Yes. She does all the scheduling, appointments.
She does everything except what I do. Yes, sir. Good man. I should feel a lot better already.
Oh, yes.
Very nice. Legs are even. Is there any pain at all there?
No, sir.
Excellent. Very good. Okay, let's come over here and shoot you now. All right. Even though we love Randall to death, we're still going to shoot him. We do this at the very end of every patient's adjustment so we can seal this into the cerebellum. So see, you're much more centered now.
Yes, much more.
Yep. Let's just have straight back here a little bit like this, and I'm going to have you translate to the left. Perfect. Yep. Hold that right there. And there. There. Perfect. Okay, now let's try that same thing one more time. It should feel smoother this time.
Yes.
Yeah, and take a look. You're pretty centered. You just got a little bit of translation there, so you're going to bring that up, head back, and then to the left. You might want to tilt left just a little bit right here, too. Head up and back. Okay, let's try that same thing one more time. I bet you this is even straighter. Yep.
Oh, yes.
Better, better, better.
Much better.
Yep, very good. So this is your Houston chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief in Houston, Texas, and Randall. We'll see you next time.